Hi, I'm Laura Graham-Holmes, an assistant professor at the Silberman School of Social Work at Hunter College, City University of New York. This project is on the healthcare utilization of LGBTQIA+ autistic adults. I worked with a wonderful team for this project of autistic advisors and co-authors and researchers from Kaiser Permanente, North California. Many autistic people are LGBTQIA+. So transgender people have 4 to 18 times the odds of being identified as autistic compared to cisgender people. Cisgender people are people whose gender is aligned with their sex assigned at birth. An autism registry study from the Netherlands found that 14% of men and almost 30% of women were lesbian, gay, bisexual, or queer. That's compared to about 4% or less people in the non-autistic population. Despite this sort of substantial group, there's really limited information about their physical and mental health. In general, there's limited information about health disparities among people with autism. And so the purpose of this study was to find out whether health disparities found for sexual and gender minority groups and for autistic people were compounded for people who are in both of those groups. Previous research found Hall and colleagues using the, I believe it's called the National Survey on Disability and Health, found higher rates of unmet healthcare needs and being actually turned away by providers among LGBT adults, autistic adults versus cisgender heterosexual autistic adults. But the study had a relatively small sample and was a retrospective online survey. So we were looking to replicate and build on that pioneering study by looking at data that was prospectively recorded by physicians in medical records and looking at a more representative sample. The setting for the study was Kaiser Permanente, North California. And the study time period that we focused on was January 2015 up to right in the beginning of the pandemic, so December 2019. KPNC serves 4.3 million people or more in the North California area. And the people that they serve, it's an integrated healthcare delivery system. And it's the people that they serve are pretty representative of the state and local population, state and regional population, except at the very extremes of income distribution. All healthcare contacts within this integrated healthcare system are recorded in electronic medical record data. So we identified autistic people who were sexual or gender minorities in this data. So our whole cohort of over 4,000 people are people who had an autism diagnosis at the beginning of that study period in January of 2015. And then we were able to identify sexual and gender minorities through either a survey that some filled out during medical appointments or through kind of a lengthy process that was conducted by a different research team who we partnered with. So this included looking at diagnostic codes and also free text clinical notes, processing and chart review for certain keywords. So they had a sort of a multi-step process to identify transgender people in the data. And then we looked to see who overlapped with us. And so our final group, you can see here, sexual minority or LGBTQ people, we had 122, transgender or gender minority people, we had 90. There was some overlap between those groups. They never are expected to be totally separate. So about 30 people were in both groups. And we compared each of those groups separately to the cisgender heterosexual group. So that was all of the autistic people who we did not identify as sexual or gender minorities. So when you're thinking about these analyses, know that we did those analyses separately. In terms of our demographics, so we have the 3 groups here. The average age for all three groups is pretty low. So that's important to keep in mind when we're talking about the health outcomes and the healthcare utilization. Gender minority were significantly lower than cisgender heterosexual in terms of their average age. There was also a higher percentage of white non-Hispanic people in the sexual minority and gender minority groups. Medicaid insurance, which we consider a proxy for socioeconomic status, looks a little different across the groups, but was not significantly different. First, I'll talk about some health outcome differences. So to compare each of those groups to the cisgender heterosexual groups, we use logistic regression, which we adjusted for age, race and ethnicity, and for the sexual minority group only, not the transgender group, for gender. So when we did those comparisons, we found that both sexual and gender minority groups had higher rates of anxiety, depression, ADHD, bipolar disorder, eating disorder, post-traumatic stress disorder compared to the cisgender heterosexual autistic people. For sexual minorities only, we also found higher rates of drug and alcohol abuse or dependence. And for gender minorities, we found higher rates of diagnoses of schizophrenia or other psychoses. We next looked at medical conditions, same comparisons here. So compared to cisgender heterosexual people, LGBTQIA plus autistic people had higher rates of autoimmune disorders, gastrointestinal disorders, endocrine, pain, and fibromyalgia. So I believe about 30% of sexual minority people had some kind of diagnosis of pain, not otherwise specified. They also had higher diagnoses of chronic fatigue syndrome and hypermobility syndrome, which our autistic advisory board suggested that we add. So thank you to them. There were no differences for things like cancer, cardiovascular disorders, metabolic, or nutrition conditions. For our healthcare utilization analyses, we also adjusted for age, race, ethnicity, and we did not adjust for gender. We weren't able to do that, but we adjusted for whether or not people had any of those categories of conditions. So it's sort of like saying we are holding, these health disparities steady, saying, controlling for the health disparities that we found, what does the healthcare utilization look like? And so even controlling for those health disparities, we still found that LGBTQIA autistic people were more likely to use mental health services, radiology and laboratory services, emergency services, urgent care, and sexual minorities were more likely to use OBGYN. There were no differences for adult internal or family medicine, neurology, or psychiatric hospitalization, which was a bit of a surprise because there was also a higher rate of suicide attempts among sexual minorities. So in this study, we found autistic people have elevated rates of psychiatric and medical conditions. We found that autistic LGBTQIA people have elevated rates compared to autistic cisgender heterosexual people. So there does appear to be a sort of intersectional effect with compounded health disparities. We also found that LGBTQIA plus people, autistic people, use healthcare services more than cisgender heterosexual autistic people. We think that a limitation here is the young age of this sample. We found pretty consistently that that mental health conditions were higher for our LGBTQIA plus groups. And those generally emerge during adolescence and early adulthood, whereas physical health conditions can emerge much later. And so what we need is a good sample of older people, or to follow people across the lifespan to find out, what happens with physical health over time. I would say another limitation of the sample is that, of course, we did not find all the LGBTQ plus people who were in this group. So I'm sure that there were some that we considered cisgender heterosexual. We know specifically that we we're not able to find a lot of non-binary people compared to binary transgender people. So that's definitely something to consider with these results. We anticipate that when we are able to identify more LGBTQ people in the data and take them out of that cisgender heterosexual category and put them in with our other people, our results would be even stronger because they would not be diluted. So what does this mean? There is a need for providers to have adequate training to serve LGBTQIA+ autistic adults across radiology, laboratory, OBGYN, across all different kinds of services. LGBTQIA+ autistic adults may also need specialized support that improve their health and service use experiences. So right now there are no LGBTQ affirming interventions for autistic people specifically. And I feel excited to move forward and create those supports as an LGBTQ+ person myself. So I'm not sure if I'm supposed to read these to you, but my questions for feedback. Does this help you understand why it's important that LGBTQ+ autistic people have different patterns of healthcare utilization? What do you think is the most important service to learn more about through qualitative interviews? I think this kind of epi data only takes us so far, and we're excited to learn, why are there more OBGYN visits, for example, for sexual minorities? It's hard to learn that from these data. So we are excited to interview people about that. And how can we make sure providers are ready to help LGBTQIA+ autistic people? Like, what do they need to know? And that's that. Thank you.